Good evening and many thanks for watching KT and welcome to this edition of Health and Wellness. May is the Mental Health Awareness Month. And what exactly does that mean, especially in a country where mental health is considered to be a ticking time bomb? That is a report that was given to the government of Kenya. But have we done anything with that? Where are we with regard to mental health? Is it a concern for everybody that we see in the country today? To have this discussion with us is Dr. Susan Geta, who is a counseling psychologist and a lecturer at African Nazarene University. And tell you what, I am happy to have Daktari because she's my star. Daktari,
oh my,
karibu.
Asante sana.
Karibu sana.
Yeah. Asante.
Yeah, so Mental Health Awareness Month. But before we even get to discuss the month, what's the status of our mental health as a country? Where are we playing at?
I think one of the things I would say we are still not doing very good is to do regular maybe statistics. So we are still saying 1 out of 4 who are admitted in hospital have one or more mental health condition, or 1 out of 5 outpatients. But if we were to cover all the statistics covering everything that World Health Organization has actually stated as a mental health concern, including burnout, right? I don't know how often people are tested for burnout, which was declared a mental health concern in 2019, the month of May again. And very many people are having serious health issues because of burnout. But where do we have such statistics even in Kenya? We also have made very many changes in terms of decriminalizing some of the things we used to say, oh, this is not a mental health condition, it's not a health issue. Like when we talk about substance abuse disorder and talking about suicide or suicidal ideations, right now on human rights basis, we are not supposed to criminalize any one of those. They are considered as people who are also in need of health services like any other person. But where do we have the data for that? We also seen something that we don't want to talk about. We really don't want to talk about this, and I don't know why. Because when we go talk about human rights, and we are talking about LGBTQ community, do we have statistics of how many of our children have taken their own lives, how many of our children have fled our country, and how are they coping out there, maybe without families, because they are depressed and they feel isolated and stigmatized? Do we have data for that? When we are also looking at the impact of the youth in Kenya, 18 to 34-year-old who are in serious crisis, in all ways, by the way. When it comes to family level, we are not agreeing. Unless a parent now also ups their game in parenting, there's a very huge gap between parents and their children because of the changes and the level of knowledge and information that they have. How many of them are so depressed and we don't have statistics? If we go to schools, and especially high schools, do we have statistics of how many of our students are on psychiatric medication because of depression, because of acute stress, because of burnout also? And how many of them have generalized anxiety disorder? Do we have statistics for that? So I am saying we have the information, we have the know-how, but right now I know the whole world is advocating for doing it together. You know, that's about support. That calls for going to the grassroots level, coming all the way to professionals like us. And again, action-oriented. We have so much. Like in Kenya, we have very beautiful documents, I will tell you. But how are we doing at the county levels? 47 counties. How many psychiatric units that can serve anybody who knocks at the door of that? The doctors. Like, it's sad. Sometimes we refer clients ourselves for psychiatric assessment. And it really makes you feel sad to hear the patient telling you, we were told there is no psychiatrist at this particular moment. We wait. So we were given a prescription to go to the pharmacy. How many psychiatrists do we have? How many are able to actually undertake those courses? Because some of this work is passion. But maybe the people who have the passion are people who have suffered. Because if you listen to many doctors, even the one we had on dental health, you might think she came from somewhere. But how many can afford to actually take themselves to schools in this country up to the level where you're good enough to notice or even to be able to supply your support to as many people as possible? We are talking about community health volunteers. How many have we trained this far? Can we say we have this number? And how are they working? So I think my biggest concern as a mental health care provider is how are we doing it and how far have we achieved?
Dr. With all this information that we have, because I remember former President Uhuru Kenyatta, it's during his time when mental health was actually, a research went into it and a lot of work went into it, that it was declared a national emergency pretty much. But since then, with that report, it's just a report. Little has been done to implement, especially the recommendations that went into that. And one then asked the question, failure to implement that report as expected, how has that affected access to the same and also just dealing with the problem?
That one just, I think it answers itself because the Mental Health Action Plan 2021-2025, I want to tell you we have very beautiful documents if you came across them. But ask about the budgeting to address issues mental health. You'll be so shocked. Maybe it could be 0.01%. And even right now, I remember we really were up, karibu twende kwa streets. We almost went to the streets as councillors because we saw an annual budget proposal for health, and mental health was not there. And if it was there, because psychiatrists are basically doctors who have specialized in psychiatry, we are still not seen as people who matter. Despite us having our act right now that is very active, we do not feature anywhere. And in mental health intervention, it's a pyramid like this. The psychiatrists are the fewest because they also take very many years in their schooling, right? And then you get to psychiatric nurses, you get to clinical psychologists who can, with the qualifications, they can actually prescribe. Come to us, counseling psychologist. Then you go to general psychologist. You go to educational psychologist. How many do we have in this country who can even help our kids in schools? So we are saying we need more people down the pyramid because there are many people suffering at the community level. But where is the budget for that? Who even thinks about it? And sometimes I wonder, if we do our statistics or our research very well, we spend a lot of money in treating other health conditions whose roots is actually our mind care issues. And so I ask myself, are we strategic enough, to think that if I am okay at this level, then I'll be okay at the workplace, I will be okay at the national level, I'll be okay across the board. But I don't think we are there. So I don't know who will come one day to make sure that all these beautiful mental health action plans and policies work. Maybe this month might change things. And even as we are in this month, I know a lot of conversation will be had during this month. We know doctors like yourself and also patients, survivors who are having these discussions as well during this month. But that aside, Dr. there is also access to hospitals, access to services from you. Because as an outsider, once one is diagnosed with the same, there is the stereotype that is there in the community, in our societies that we do exist, because mental health has for a very long time been associated with witchcraft. It's been associated with bad omen, and these are things that still exist today. But I want to talk about if someone is sick, go to anywhere in this country, inafaa ende Madhari. That goes to show that as a people, we do not have facilities. We do not know where these facilities are. And that would be because professionals who are working there, the numbers of psychologists, psychiatrists that are needed in these spaces are not enough. Yeah.
How is that as well then limiting people from going to seek for assistance?
You know, to reduce stigma, we call upon like those, let me say, witnesses or people who give their own testimony to come out, or people like me to come out and say, yes, I am a daughter of a late father who survived mental health illness challenges and finally died in that very hospital, Mathari National Teaching and Referral Hospital. By then they used to call it Mathari Mental Hospital.
Yeah.
Having said that, we need people to come out. For example, I could be with you, Dennis, and maybe you're bipolar. Once you get to know you are, and there are many causes to that, what's wrong with me sharing my challenges? Unless we reduce that stigma ourselves. If there is somebody struggling with mental health challenges next to me, how am I treating them? If it's at the workplace, are we saying this person should go home now that they can't work? Or we need to have to know how to work around and retain them to work at their level? Because if you're talking about people living with any form of disability, there is that point that when you have mental health challenges peaking or you have several episodes, you cannot work. Are we stigmatizing that person, wherever they may be? So when I think about the 47 counties, you go, I don't know when there was the last time you visited Mathari National Teaching and Referral Hospital, because I do go there to supervise my students and sometimes assess what is going on. You'll be so shocked. There are families who are very happy that their members of the family are there. And they will do anything even to pay for them to stay there because they cannot manage them at home. What if these CNAs, the certified nursing assistants, are actually trained in basic mental health and wellness care? They would know how to handle them. You see me there at Mathari. You will see those people that people call mad, because I lived with my dad as well. Having a conversation with me even when it's not making sense. Because even if I may not be okay mentally, I really have my emotional well-being. But who can be trained to do that? The psychiatrists, I have told you, they are up there. Sometimes they have to, like, oh, what's the problem with this patient? Then they give recommendations. But the people down there, by the time somebody gets an episode, because I believe in prevention personally, and support if it has happened, who is there? Who is noticing? We actually notice someone is not okay mentally when we are taking them to see that psychiatric doctor. But we do not know it when we are still with them. And that is why community health volunteers, community health practitioners, we need more and more of them trained. Prioritizing the budget for that is the key. Otherwise, every county, not even every county, because now we are talking about Nairobi County, should have a well-furnished and established mental health and wellness center. If you go to every sub-county, and I want to tell you, it's still not enough, because we should actually have those services at the grassroots level. That is what we call the community health facilities, like the level 2 and level 3 hospital, because at the end of the day, the idea is to integrate mental health into primary health care. Where is Kenya? Where can we say we are, you know? And it's not hard. Why am I saying it's not hard? We all try to do something small just to see whether it works. I'm an advocate, and a serious one, for community-based mental health intervention. And so this far, I have trained like 60 in Thika sub-county. I have trained like 30 in Kikuyu. And they are doing an amazing job, such that if there is a grief and bereavement situation in the village, how many people might start getting sick from that? If you have complex grief, you are likely, if it goes beyond 6 months, to have depression. Who is there to help you, like talk it out, process it? If you have someone, a young person who's well-schooled, no job, who is there as a mentor? You know, broad-based approach. and to tell them this, what else do you have in your hands? What else do you have in your head that you can use to make yourself feel important or to make yourself valuable wherever you are? Who is there? But these things are doable. What we lack is strategy for me. Yeah. Because even in the church right now, I was very happy meeting a pastor at the Wasco Thika. I'd gone there to just give a small talk on reducing stigma and sensitizing the workers on the need to go and see a counselor, the need to even say, I want to check into a rehab if I cannot control my drinking. There's nothing wrong with that. You and every other person who goes to the hospital, we are saying, we are sick, so can we go see a doctor? And one of the pastors told me, I have actually gone back to school because I've realized not everything that I will pray for or try to deliver will work. Now I see there has to be something to be done to the mind. That approach, other than talking too much, we just need to be action-oriented. And being action-oriented, if the government can't do much, what are you doing at your level? What are the pastors doing? What are the teachers doing? And I'm very happy maybe to tell you, I'm not blowing anybody's trumpet, but I'll be going to Mugoiri. It's a national school for girls. And they have a whole week, mental health and wellness week for the workers, for everybody. In fact, if they're the principals, the first thing they will tell you is that I have burnout. How do I work it out? You can imagine that kind of dedication in the month like this one. A child who is there who does not know they have depression or depressive symptoms, they have burnt out, that's why they are sleeping in class and they don't want to go to class, that's why they're irritable, and the school is noticing that. What about the worker? The kitchen employees? What about the security guards? You can imagine in national school, who are you dealing with? The who is who in the country, you know, and you're just a simple guard, right? So if we can all do something, all of us, because prevention to me, and it's something I have tested, is far much better and cheaper. Support, yes, when it happens. Other than saying, let's wait and see. Even the medication is damn expensive. Today you hear your own family member is sick, has a mental illness that requires medication. You guys, you start counting as a family. Where are we going to get this medication? Because by the time somebody gets an episode, it means the brain, the neurons have been fired differently. And for them to be rewired to fire, right, that needs, you need medication. So that medication is not cheap. It's not cheap. By the time Kenya gets psychedelics, because now it is enhanced treatment, I don't know how many of us are going to afford that. I'm basically going to understand, because I'm not a medic, but I will be going to study more about psychedelics just in a short while, just to understand, because it breaks my heart to see someone struggling with depression over years and this doesn't come to an end. Someone struggling with craving and they really want to quit addiction of whatever form, and it can't happen. In developed countries, they have that treatment, but when you don't understand it and you don't know it, I don't know whether doctors in Kenya are talking about it or they are waiting to tell us when we can't afford it. Because I always say third world countries, as much as they say we are disadvantaged, we are advantaged. Why? Because we can learn from the best. And by the time this is happening to us, what are we doing? That's why sometimes people say I'm crazy. Like when I talk about our children and how we need to protect them, I'm a serious child protection advocate. And when I see a child being sent away from school because they are addicted to drugs, other than seeking help for them, I am one person who says you're adding more trouble to the nation.
To the nation.
Yeah.
Dr. You see, we live in a society where you'd hear people speak of just kawaida banter. Leo niko na stress. You know, I'm feeling depressed. You know, but a little bit of search on what those terms means, they squarely fall into mental health space. But we also find ourselves unaware of where to go to next. So we want to speak in terms of individuals understanding that it is okay not to be okay. It is okay to talk, it is okay to share. and that the larger population as well should be understanding that when someone comes with a problem, the most you can do is listen and offer help. Because most of the time is, you'd find even a child in school say they're stressed, but you hear, oh, na stress, not ulipi school fees, ulipi rent.
Exactly.
You know, just speak to such, because it's through that dismissal that you find many start staying into their own bubble and in their space, because they don't know how to let out.
So, yes, people say, Niko na stress, Niko depressed. Sometimes it's good to just break that down.
Yeah.
Because stress, we all go through stress. It's a state of tension that disorganizes like your daily routine. Like you wake up and you're not happy, and you wake up, there's too much to do. And there's that acute stress, especially in cases of crisis and emergency. And that can escalate many other issues in the body because of the cortisol and adrenaline levels. They're very high in acute stress. So you might even have people having very serious panic attack, which can affect the heart and blood pressure. And you're like, today my blood pressure was up, and then tomorrow it's okay. What happened? You know? And that's stress. We also have eustress. Someone who is planning for a wedding. You've all an award. You're going to be celebrated. And that there are people who are not able to tone down, especially people who have the obsessive compulsive, maybe a challenge. Like I'm thinking of something, I can't even sleep because I know of that. You know, it's already stress in itself. Then when we come down to burnout, that is exhaustion, physically, mentally, emotionally, socially. Like you love your job. You get to a level you're like, oh, by me, I'm going on leave, whether you guys like it or not, because I can't do it. They will not like the dentist that they are used to. And nobody wants to understand that. It's like, hi, umechoka na kazi. People are looking for jobs. And you seem to be joking with you.
You
know? And at that, for the World Health Organization to declare that a serious mental health condition, because very many people had taken their own lives. Because I can't do it, I know I need this job. And nobody wants to understand this. HR, maybe. Human capital does not understand. Family doesn't want to understand. Very many people will take their own lives. How many will say, I have been so tired with this work, that's why I've taken my life? How many? You just take your life and you're gone, right? Then we do have now, as we get down, if you cannot manage stress, whatever form of stress it is, today, another day, 2 weeks, now we start saying you need to be assessed for depression. And if you have all the signs and symptoms of depression, then if you check in into any health facility, they will start you on medication. And yet, baby, all you needed was to relax. All you needed was to share, especially in case of traumatic stress. Traumatic stress is, imagine you're preparing for a wedding, for example, and then your spouse or your spouse-to-be says, I have changed my mind, and you had called everybody.
There is no I do this time.
Parents, whose children have gotten issues of mental health challenges from whatever angle. And they tell you, my graduation is on this day. And you guys show up. You even print cards.
Terry, let's take a short commercial break. And when we come back, we look at solutions there are and more information during this month, right? Let's take this short commercial break. We'll be back with much more right here on Health and Wellness. Welcome back. We continue the conversation on matters to do with mental health. Dr. As we went on the break, we were talking about acute stress and what that means. You know, when you go to the ground, different. You'd find someone has actually complained about something they've that they've gone through. And most of the time, we anakapitia sana, but we don't go further to seek for assistance for them, for us to step in and fill the gap and offer the support. What have you seen?
Yes, that is very true. And for some people, the family members even have to use very dubious tricks to actually bring them to a counselor. And you know, a counselor is like the basic mental health practitioner before you're referred to a psychiatrist or even a clinical psychologist. And so I think for me is to just accept. If you are stressed, accept. And don't be ashamed. If it's your boss at the workplace, just tell them, right now, I want to do good work. I want to perform, but right now I can't. And sometimes it only needs you to have a day off and sleep. Like, how do doctors do it? When they find you have like checked into a health facility and they discover your blood pressure is high, maybe you didn't even know it, they actually make you stick around so that they can test it again to find, is it gonna go down? If not, then they can consider maybe the other test to be done. If you come to a counselor, what's the big deal? Just tell me what's going on in your life. By the way, counselors, we are trained to listen, nothing more. And I wish more and more people can come out and say, I was just listened to. And if you know you're a good counselor, people make referrals. Just like good doctors, they make referrals. Because I went to so and so, imagine, I don't even know what happened. Because in the way you are talking about stress, and whether it's accumulated or acute, what we are trying to help you with that talk therapy is to align your mind. That alignment is very critical. And I'm sure even as you sit here, there's one time you're so stressed up and you're like, oh my, this and this has happened, but somebody listened keenly. They didn't even offer a solution. You felt some relief. That is our work. And we spend more time with our clients, 45 to 1 hour. If it's a family, 2 hours, because everybody is talking. If it's a couple, 1.5 hours, good job. What's wrong with that? The only challenge I know, and I feel sad, is the cost. How many people can afford professional counseling services? I am not talking about the one you do assess, you're like, you need help. Professional counseling services. Go and check the rate and you tell me. But today, there's a part they are adding on health insurance, right? Especially for corporate, I don't know about the government, on wellness, you know? Yes. The wellness package, just to give it a good name. There's nothing wrong calling it mental health and wellness. Such that when I go there, I can tell you, you know, I've been seeing some ghosts while I'm sleeping, so that I'm not afraid to say. I've become forgetful these days, and it's too much. Just share that, sharing that. What's wrong with that? So we need more people to come out and say that it is okay to not be okay. And it is okay to share with someone. Sometimes people fear, and that's why maybe we need more professionals. They fear if I come and share something with you, you're going to share it with other people. That's why professional counseling services are very important. And people need to know right now, the professional counselors are being licensed. So the government knows. And there's no faking. So you're not going to call yourself a doctor. And this government of Kenya, counselors and psychologists board, lists you as a doctor. Because they'll get all your papers. They will actually go and investigate, right? And I know very soon people would rather take an opportunity now and give themselves better education. Because the government of Kenya, because of the level where we are licensing diploma holders. If you go to any other country, including South Africa and Nigeria, unless you have a minimum of a master's degree, you cannot be licensed. You can only practice under another one. Not that in Kenya. So, but when I also look at the support to the counselors and psychologists board by the government, I don't think I see it. I see themselves trying to raise funds by trying to give what we call CPDs, the professional development short courses. That board should be well funded, such that we can be able to get the best from where they are hiding, maybe, to come and serve. The Public Service Commission, how many have we employed? You know, I do support where I can, Dennis.
Yeah.
Right now, because we do have counselors in the military, we have counselors in the police department. We have a whole directorate of counseling services. Why would a police officer opt to go out and pay for counseling services other than maybe go to the counselors there? Maybe they have not done enough sensitization. And I don't know whether it breaks your heart to see a police officer or a military officer who turns their gun against the very people they have worked so hard for, right? And if anybody cares about mental health issues, then we need to act. So maybe to the ones watching us, if you cannot talk to anyone, kindly talk to yourself. I don't know whether when you're doing literature, there are people who would go and talk to the trees, go and talk to themselves.
Mirror.
And I think I used to do it when I was in high school, when I used to think there's too much pressure and many other things around me. I would actually go near a fish pond and I would really talk to myself. If you throw yourself here, oh, if you survive Susan, oh, you'll be the laughing stock. You know, you're talking to yourself and finally you end up laughing at what you're experiencing and you're like, after all, it's not that bad. If you cannot talk to anyone, if you're good at writing, please write it. If it's someone you feel you cannot forgive because whatever they did to you, you think is unforgivable, do them a letter. Read it and see how evil you could also be when you read that, okay? And how disturbed you have been for the longest time. If you want to keep a good day, every day if you want to, do the journaling. Like, look at 3 things every day. How were my thoughts today? And if you have more positive thoughts or you negated more, you disputed more negative thoughts, you're likely to experience positive mental health status. If you have a list of gratitude points other than complaints, you are likely to actually enhance your mental health and wellness. If you pray with intentionality and you pray with a focus where you're not shouting so much, you're calm, you are enhancing. I'm saying this to the people who pray, the ones who practice a lot of maybe spirituality, which also helps. If I observe and reflect on my feelings, like if I ask you, Dennis, how are you feeling right now? What would you say? Some people say, I'm just feeling good. Good is general. Are you angry? Are you feeling irritable? You know, are you happy? Being very specific, very simple things. Then how are you acting right now in this state? Or what do you feel? Or what do you think like doing? Of course, feelers will appeal more to feeling, the feeler personality, and the thinker personality, mostly the men. If you ask them, what do you want to do right now? If what they are about to do is negative, then it makes things worse. For example, when somebody gets into addictive behavior, like very tired, today I go very tired at the workplace, burudika na moja after kazi, you know? And you go there, and the first time you did 1 bottle of beer or 1 tot, tomorrow you add, you're getting sick and you're actually damaging your brain. So at the end of the day, that which you wanted to sort out, you cannot sort out. Why? Because what you have injected into your brain does not empower your cognitive functioning. It disempowers it. So sometimes I just tell people, can you even sit down somewhere? Just sit and tell your mind to think about nothing. Or just tell your heart, let me feel you. That's mindfulness. And that is a practice, if you research, is now going around the whole world. Because there is power in living in the present moment without judgment. If I'm feeling so angry, can I acknowledge, right now I'm so angry, I think I want to punch someone or punch the wall. Acknowledge that. And then take a deep breath. And breathe in through the nostrils, not just breathing. Then you hold. then out. You will notice. And if you can make it a habit on a daily basis, if you want to see people who fight so fast, they insult very fast, they make irrational decisions very fast, they do not have moments of mindfulness. In fact, if the people who take their own lives or take other people's lives were to backtrack and take a moment, they would tell you, I would not have done it. And so, what is it that we are doing today to make there as many people as possible, including our own children, are practicing mindfulness? Your own son, your own daughter comes to you and tells you, Mommy, oh, you know, Joseph has been, and you're like, you as a mother, you also go back that way. The child now gets disoriented. What if you tell them, can you calm down? Can you breathe in and out? Now tell me what was going on. If we can start, because I love children so much. If we can start with the kids, they are going to parent us, which is okay. Yeah. Because majority of us tried to parent our mothers and our fathers because all children in the whole world, that's why we love them. And if you look at especially men, when things are not working well at home, they will go to the youngest child and tell them, Mommy, come here, Daddy, come here. Why? Because the child's spirit has not been tarnished. When I say about the spirit, because it's only a soul that does not want to ruin anyone that you would feel attracted to. And those are the children, right? And so if they tell you, Daddy, stop shouting, please stop if you can. Because tomorrow, that shouting, if it does not stop, it is you who is going to be haunted by it. Tati, you come home so late. Tati, why are your eyes like this? Why are you walking like this? Are you sick? You know you are drunk. Yeah. Listen, and tomorrow try and come home early, because tomorrow they repeat. If not 99% of your children repeating that, and it's going to haunt you. Because the very thing the child was telling you don't, they were basically telling you there is discomfort. Yeah. Children don't hide, but we adults, we like to hide a lot.
You know, Doc, in all this conversation, there is the health-seeking behavior. We live in a society where you're only sick if you're suffering from malaria. You're only sick if you hurt your toe and you need a bandage. You're only sick if you're treating cancer or diabetes. Yet you realize that even earlier when you're speaking about someone who has pressure and how doctors deal with that, they would tell you to just come after 20, 30 minutes, then you take that taste. And most of the time you'd find that the pressure has gone down. I'm actually a candidate of that. Happened once in these same premises, because I remember we had a wellness month, and I walked in and they took my pressure. It was very high, and the doctor asked, so what's up? Have you had coffee? I'm like, yeah, I'm just from having coffee. And she told me, just go come after 30 minutes, then we check the test again. And after the 30 minutes, the pressure had gone down. So it is in, first of all, seeking our seeking behavior, because we need to, I think, break down the barriers that have been there, that sickness is only malaria, sickness is only lung disease, that people with mental illness are patients and need assistance, and the very best at that matter.
So it's good to be honest that you once had that. For us, faculty, actually, lecturers, if we want to be very honest, all over the world, we have our days of those high blood pressure spikes. And that's why I think when you say it should be a routine checkup, or even having that, and especially after 50 years, don't sit there thinking your body is working the same way. If you look at your car after some years, it's not working as. What about our bodies? And for women specifically, the minute you get to around 40 years, the estrogen levels starts declining very fast. And that means your other organs that really contribute to your well-being are also not functioning well. That's when you find that someone who never used to be makelele person, they are making a lot of noise. Yes. And especially when they all go to 50, 60 with menopause. And you can imagine if you're also having blood pressure issues as a woman, it means most of the time in your own world. Yeah. But if you find this disturbing you, you start getting that stress. That stress becomes distress. That distress becomes depression. And so accepting your status quo is the best. And I have told you, you're tired, say I'm tired. Yeah. Even the children we are forcing in school to study, we are forcing them because we have targets. Honestly speaking, do you want to lose someone? They would rather come and farm there if there's a shamba there. With all due respect to the people in school, other than putting pressure. And I'm thinking if we are also taking our education, CBE education, practically, it's going to reduce a lot of this pressure on our children, because they are enjoying more of coming home, they are doing the knitting, they are sewing. Like us, you guys missed that. As we know how to run the stitches
the
and
cooking and
yes, we do know that, and we learned a lot of that from school. Because doing work with your hands also moves the body. The other thing we take for granted, and it's very, very important, is walking. Those of us who cannot have timelines for the gym because you may not have the discipline for it or where it is, can you walk? And if you don't have a safe neighborhood where you can walk right in your house, and walk as you're counting. 1, 2, 1, 2, 1, 2. Don't just walk. 1, 2, 1, 2, because that enhances the blood flow. And as your blood flows smoothly, your brain is also working that way. Actually, we say food for the brain is adequate oxygen. Just to give it that. That's why you find people breathing. And they feel so nice.
Yeah.
And that air, do you go to buy it?
No.
No, you don't buy that air. Yeah, we've all been given this air. So for me, maybe, Dennis, what I would like to say is that, can we come out, more of us, including our national leaders? Imagine if somebody came out and told us that you people have stressed me so much. Now I have burnout. I can't think straight because of you. Retreats for anybody with a high profile position in any company. You people in the media, because you must always be up to date with what we need. That means your mind is working round the clock.
Round the clock, yeah.
So if you do not take care of yourself, people in the health sector, emergencies, doctors, because at the end of the day, people look for other medications.
Yeah.
Like you think coffee is helping you to stay alert, but coffee is a stimulant, right? What is it going to do to your brain finally if you're not going to get drunk? Yeah. What about fast foods? Because I do not even have time to take good lunch or take a good meal. What is that going to do to you finally? And so for me, is more of psychoeducation. Psychoeducation basically means you educate to change the thinking. And to educate to change the thinking, we need all players. All players. We need entertainers. We need comedians to learn this. All these road shows that you do. Yeah. Who gives the mental health tips to people? Because whenever I'm invited even to local churches and I'm talking about just stress, how stress affects the body and how the stress long-term affects the mind, people are like, I did not know. I didn't know this. So we need, even in the churches, that we do have, if it's possible, let's not wait for the month of May. Yeah. Let's have tips all over on how to check the basic signs and symptoms of mental health illness, or just to check on whether you're doing well on your health and wellness, wherever we are and whatever we do. Yeah. I know the corporate world always is pushed, and it's usually the first one. If you go to many companies right now, you will see they have that wellness package. Yeah. But when we come to the people that serve the nation, I call them the civil servants. How well are they taken care of? when I hear of the SHA, the SHIF, actually there is serious advocates to have that families can seek counseling and psychiatric services, right? But for me, it's the action.
Yes. Dr. a lot to be said.
Sure.
But I think the line for me in this conversation is that food for the brain is adequate oxygen. That is my takeaway conversation. And I think this also goes back to those who are listening to us, to government policymakers, that there's a lot that needs to be done, that mental health is an important aspect of our daily being. Just breathe, just walk, and remember to count 1, 2, 1, 2. Asante sana. We had Dr. Susan Gitau, who is as well who is a psychologist, counseling psychologist and lecturer, African Nazarene University. Asante sana as we keep on with this conversation. And ladies and gentlemen, remember to breathe in and out. Enjoy the rest of your viewing. Good evening.